Healthcare systems are rapidly evolving to meet patients where they are, online and on demand. Our next guest, Emily Will, is leading this digital transformation as Clinical Strategy Director at DexCare. Drawing from her 15 plus years as a certified orthopedic nurse and firsthand experience implementing DexCare's platform, Emily brings unique insights into modernizing care access and delivery. Additionally, as co-chair of the American Nurses Association's Innovation Advisory Committee, Emily champions new care models that optimize both patient and provider experiences. Join us to discover how DexCare's intelligent orchestration platform is revolutionizing how health systems get discovered at the point of search, match patients to best fit care options, and maximize provider capacity, all while delivering the seamless digital experience today's healthcare consumers expect. Let's go.
Welcome to Passionate Pioneers with Mike Biselli, where we highlight and speak with the innovators, the game changers, and the pioneers who are deeply passionate and relentless in solving the problems our world is facing today. This is your opportunity to connect with and learn from these leaders and to support them on their mission. Perhaps they will soon be hearing your story as well. This is Passionate Pioneers with Mike Biselli. I look forward to having you on this journey with us.
Hi, Emily. Welcome to our podcast today.
Thanks so much for having me, Mike. Looking forward to our conversation.
Well, given your passion for innovation and your dedication to improving patient access and ambulatory care, and your current efforts in helping health systems deliver integrated, accessible, and patient-centered care, I'm looking forward to our conversation today. But before we dive in, a bit of housekeeping. While listening to any of our episodes, please take a moment to subscribe to the podcast so you will automatically receive episode updates in your podcast player. Simply search Passionate Pioneers with Mike Biselli in Apple Podcasts, Spotify, or wherever you listen to your podcasts. And lastly, please visit the bottom of the episode notes to connect with me on LinkedIn and X in order to further the conversations occurring on this podcast. All right, Emily, it's almost time for our community to learn how you and the DexCare team are enabling health systems to get discovered at the point of search, navigate patients to best fit care, all while optimizing provider capacity and resources in real time. But first, what's that one piece of advice that you would give to others who are passionate about reimagining the health of our world?
So the one advice that I would give to those that are passionate about improving healthcare is really to surround yourself with an amazing team. As a former athlete, I realize the impact of having a team that supports me and can fill in the gaps where my weaknesses are and amplifies where my strengths are. Having a great team around you really allows you to be as passionate as you can be.
Well, Emily, now you got me fired up. I'm a former college athlete myself. So, we could turn this podcast into sports and team sports all day long. But in all seriousness and no joking matter, I cannot tell you how much I still rely on, many, many years later, rely on those learned lessons with my team members and being able to support one another. I know it's so cliche, but the whole teamwork makes the dream work kind of thing. It's so, so powerful yet still today as we continue to build the companies that I'm affiliated with. Emily, has that been a part of your professional career as well? And are you always trying to work and help team members understand that as well? Because you know as well as I do, reimagining, reinventing, reshaping how we deliver care, how we continue to move healthcare forward is a very daunting task. How has that been building that culture to make sure that teams are working together and that we have to rely on one another to really help turn the tide on this very big ship that is this complex industry called healthcare?
Absolutely. It is. It's been a part of my career since day one. As a brand new nurse, I realized that as I started, that I needed a team around me to be able to deliver effective patient care. Working with some of the best orthopedic surgeons in the Milwaukee area, driving efficiencies, bringing new innovative procedures to our patients, it all takes teamwork. I also think that healthcare is a spot where teamwork hasn't always been a concept that's been well utilized. And oftentimes we think everyone is the same. But I think, Mike, you and I would both agree that the most successful teams that we've been a part of, every person on that team knows exactly what their role is, what role they play, how they are going to impact and reach the goals that are set. And so I've taken those lessons, applied it to my leadership journey, created a team-based care model for the orthopedic clinic that I used to manage during the pandemic when we were struggling with staffing, when we were struggling with call-ins, you and I both know that during those early days of the pandemic, it was about survival. And the only way that we were able to survive and thrive as a clinic was having a strong team where each of our team members knew exactly what their role was, but that they could also flex and pick up the slack for a team member that was having an off day. And that's really where my passion for care model redesign really has intersected with my athletic passion, is understanding how we can redesign care, how we can transform how patients experience their care. And that's really what led me to DexCare and being able to amplify care teams at some of the largest health systems in the country, making sure that each member of their care team is utilized to the top of their license.
Well, we're going to dive into that, Emily. It is one heck of a story. This company, DexCare, you just mentioned it. Talk about a heck of a team. An unbelievable story. We're going to discuss the story, the team, everything that is happening in the DexCare camp, where you guys are today, and where you're heading to tomorrow. We have so much to discuss after we get back from thanking our community champion sponsor.
Healthcare faces a paradox that echoes through generations. While the current practices that help heal patients today are vital, it is crucial to evaluate them through an environmental lens. OSHA's Responsible for Tomorrow initiative is a collection of interviews featuring influential thought leaders and industry experts like you, who share their sustainability strategies, insights, and provide valuable perspectives from diverse industries to inspire innovation within the healthcare sector. OSHA invites you to join this journey. Want to share your sustainability story? OSHA is actively looking for partners to highlight the important and inspiring work being done around the globe. Check out OSHA's Responsible for Tomorrow initiative and series at OSHA.com. That's OSSUR.com. Or visit the episode notes and click on their link. Together, and with OSHA helping lead the way, let's all be responsible for tomorrow.
All right, we are back with Emily Will, Clinical Strategy Director at DexCare. Emily, thank you so much. Love how we started off on this podcast talking about teamwork, talking about what it takes to move the industry forward, relying on your team, making sure that we are closely working together because this is a tough, tough industry to move. But I know we can do it when we do it together. So, Emily, we have a lot to discuss today. Obviously, now 4-ish years spinning out of Providence, a heck of a company, DexCare, a heck of a story behind it. I know you've been with the company almost 2 years now. Can't wait to hear a little bit how it all came to be, how you found DexCare, how they found you, how you joined the company, going from kind of that pure clinical setting, incredible transition into a phenomenal organization. Then, of course, got to discuss where is DexCare today? How are things going in the marketplace? And then, of course, where are things heading to tomorrow? And what we should be thinking about as a community tuning into the podcast. What should we be thinking about kind of from your vantage point, your team's vantage point? And then, of course, we can't get you out of here until we ask you how we can be helping you. We always love to be able to help our guests. But first, Emily, let's go ahead and start kind of from ground zero. Let's discuss, how did this all come to be in the first place? How did you find DexCare? How did they find you? How did this all come into focus for you to be a key team member over at DexCare?
So my journey with DexCare started in 2019, actually, in the fall of 2019. I was working for a health system here in the Midwest, and our innovation arm brought in this company from Providence's digital innovation group. It was DexCare. I was leading an orthopedic clinic at the time and really was in charge of helping to bolster not only our access within our general orthopedic clinic, our sports medicine clinics, but also our orthopedic urgent care. And so as I met with the DexCare team, in a matter of moments, I realized the power of what DexCare was trying to do. They were trying to help us to highlight the inventory of appointments that we had that were historically going unutilized because our schedulers couldn't remember that we had other clinics outside of our historical academic clinics that were the flagships. And we had spent a tremendous amount of resources expanding into our communities. Those clinics were going unutilized. And so our innovation group saw an opportunity for us to really be a part of the leading edge of access and demand generation online, meeting our patients where they were at. And so it began a tremendous journey that started pre-pandemic. It got paused during the pandemic when all of a sudden we knew we didn't need more patients and we needed to figure out how to manage our existing patients. And then the DexCare strategy became a key part of our pandemic recovery. We had more patients than we knew what to do with, how to manage it, and we had unutilized APPs that were sitting idle in these clinics. And so through the ability of the DexCare platform to help us be discoverable, have our patients find care, we were able to increase our slot utilization by about 75%. We were able to drive access. We were able to have our patients know that before they got in their car and drive to a clinic, that they were going to have an appointment, that they were going to be seen today for that orthopedic condition. We kept patients out of our emergency rooms. We kept non-emergent, non-surgical patients out of our surgeons' offices. And we were able to improve our access metrics through, surfacing these same-day slots that were sitting there, but were going unutilized. It was then that I realized that this was a transformative product and a transformative company. Flash forward to 2023, and DexCare posted a role for a clinical strategy director. And I knew it was my next career move. I knew that I had to be able to take what had worked so well for our situation and take it to the broader healthcare community. And so by bringing in someone that has lived and breathed the experience as a customer, but also the front end, the clinical experience that I have, the leadership that I've had, opens up doors, allows me to have conversations with our partners and our health systems to really continue to drive innovation, not only for them, but for their patients. And that's what gets me up every day and keeps me engaged at DexCare.
Oh, wow. Unbelievable. I absolutely love it. And this is exactly how some of this stuff comes to be, right? There they are being incubated inside of Providence. They come and get to be out in the real world, right? Not just in a theoretical or academic setting, but they are interfacing with leaders like you in the real world. So let's go back some of those moments in time again, because I think it's just so powerful. You absolutely noticed the transformative effect that DexCare could bring to your communities and to everything that you just discussed. But was that ever that moment like, why hasn't this been done before? Or maybe DexCare is doing it differently. What caught your eye? What made it so magical from your perspective versus, and as well as I do, in healthcare, one of the biggest killers of innovation is a two-worded term, status quo, right? We've always do the same thing the same way all the time, right? It just absolutely kills innovation. But from a leader, from your perspective and being on that clinical setting, what was the magic that you saw? Maybe that was differentiated than something that you've never seen before, so much so that you wanted to be actually a part of the company. What was that magic that you saw?
Yeah, I think it was really the magic of meeting the patients where they were at, right? For the first time, I realized that patients didn't just Google our medical website. They were at Google searching for care, trying to find out where was the nearest place for me to get orthopedic care today. It wasn't just that they were stumbling upon our website. They needed to have help in that discovery process. I think also the thing that mattered and why we were able to be as successful as we were is that from a service line standpoint, our medical director and our chairman of orthopedics had keyed a phrase that was a culture of yes. And it was really transformative about that it didn't have to be the perfect patient in these clinics, but it was the spot that they were choosing today. And so by instituting this culture of yes, it was that, yes, we can do something today. We may not be able to do it all, but we can get that x-ray. We can be that patient's peace of mind. We can get them to the right spot. And while we're doing that, we're also improving our own access, right? And driving and helping to keep patients out of spots that they didn't necessarily need to be. And so that was really when I saw the ability for us to not necessarily have to make more brick and mortar buildings, open new clinics, but be able to surface our access in a way that was allowing patients to find it for themselves. It really was kind of that aha moment for me, that it wasn't that we needed to hire more people. It wasn't that we needed to build more clinics. we needed to have a tool that helped to surface the availability that we did have.
Very well said. I love that. And there's a lot of magic in there. I couldn't agree more with you. You see it time and again across this nation. I mean, there's just the capacity or lack thereof in regards to filling it has been pervasive time and again. We just have to have that intelligence layer, that ability to be able to surface and be able to fill those slots, which of course you guys are doing in spades. So let's go there, Emily. For our community that is new to DexCare, who is DexCare?
So DexCare is in the business of patient acquisition, in the helping health systems to not only be discovered at Google, but helping their patients through a care orchestration platform find the right care at the right time with the right provider. Really, I always tell people, patients, friends, that my goal at DexCare is to make it as easy to find the care that you need as it is to order your Starbucks in the morning.
I mean, that's pretty clear, cut and dry. I absolutely love it, Emily. And in regards to, the successes that you and the team are finding today, how does that happen tactically? Is this, the big buzzword right now in healthcare is AI? Like, how does this work? Let's get into maybe a little bit of the nitty gritty. If I am that health system, if I am in those communities, what is this doing for me? And then, of course, we'll talk a little bit as well of how the patient is experiencing it. Because I think, obviously, as well as I do, there's much more happening than just entering some words into Google. There's a lot of ways now to hopefully discover the right care at the right time with DexCare powering a lot of that. But maybe let's start first on the kind of the provider side. What does this look like? What does this mean for them? Kind of give us the tactics of how this actually works.
Yeah, absolutely. So at DexCare, we are working with their EMR, whether it is Epic or Athena or even Cerner. We have the ability to work with all three of those. We are able to pull in their whatever access that they have in their system. And then what we're doing, and I think this is the difference of DexCare, is we're able to, through our acquisition of Womp Mobile, we have really brought that e-commerce appeal to the health systems. I think this is the key differentiator. So often in healthcare today, and I'm sure we've all experienced it, right? You're either searching at Google, you land on a page where you think you're going to end up getting to see the provider that you need to see, only to be hit with a dead end, whether they aren't scheduling online appointments, they don't have access. And that's where DexCare is different. So DexCare believes that patients should have options at the point of search. And so we may surface a close location that's within 5 or 10 miles, depending on the health system in the metro area. We may surface their virtual care options, or we might even surface, like we talked about earlier, the members of their care team, right? Their APP or another physician at their practice that may be that has openings. It truly is about creating a patient-centric approach to care where there is no dead end and no patient is left floundering to figure out what a next best step is. And so whether that search starts at Google for urgent care near me, or it's you have a trusted health system that and you are going to, and you're searching there for, say, fever, and you're being given those health systems' best resources. In the case of some of our health system partners, they're choosing to surface virtual care first. And what we've seen is that when someone searches for something such as fever, and you surface virtual care as their first option in their search results, they are going to utilize it. One of our health system partners has seen a 4-time increase in their amount of virtual visits while decreasing the time to see a primary care or any other kind of physician at the health system by 5 days. To me, it's about giving that patient options that meet their needs, right? When they're searching for fever, they maybe don't need to see their primary care doctor who's got 96 hours at a minimum to be seen, but they want to see somebody within minutes or days or hours, right? Like it's giving them those options, whether it's an urgent care, virtual care, or seeing a primary care physician, that is truly transformative.
And even think about that, right? Like if I have a fever right now, do I also want to go and climb out of my bed and get out of my car or get out of my house, get into a car and then have to sit in a waiting room? No, I don't. I don't. Meet me where I want to be met, right? And so being able to couple a lot, that's absolutely brilliant and incredibly powerful. Emily, what has been the response from your health system customers and the folks that you were working with? What has been the response from those folks?
I think it's much like mine was when I was a customer. It's thinking and seeing the results that you only dreamed were possible, right? It is when you can see that transformation and that shift to virtual first care for a health system that can unburden their primary care offices, that can decrease access to care. We know that the access to care metrics in this country are ever increasing. We know that it takes on average 20 days to see an orthopedic surgeon, on average 29 days across the country to be seen by a primary care provider. And in Boston, it can be over 60 days to be seen by a primary care provider. Our health systems need to have a way to surface the available care that isn't always just an appointment in an office with a provider. We need to be able to surface not only their care teams, we talked about having the ability for healthcare to be delivered in a team situation, right? So can we surface that APP? Can we surface a virtual visit with a virtual provider? Can we surface their e-visit protocols that are leveraging their nurses and their care teams? We have a health system that is leveraging those e-visit protocols and putting their nurses and their virtual care team to help even speed through the virtual visit process. Those nurses can take that UTI patient that can answer a few questions asynchronously with that nurse and get the care that they need, saving that virtual provider for the more serious or maybe not the clear-cut diagnosis and care. So all of that, I think, really has opened our health system's eyes to what is possible. We have a health system that has had tremendous success in their virtual urgent care. And they're starting to think about what other specialties can we utilize virtual urgent care for? Can we use it for mental health and utilize it for a crisis line? And what does that look like? And how can that help to transform care across a health system, right? And it takes it outside and it reaches rural areas, it reaches remote areas that may not otherwise have access to those kinds of services. So all of those things, I think, are tremendous tools in our health systems tool belt to tackle some of today's biggest challenges, from provider burnout to access to care, to readmissions, to length of stay challenges, and ever shrinking margins within our healthcare system. Being able to leverage assets in virtual care can be a huge game changer from a cost savings perspective, not only for our patients, but for our health systems.
Well, another area that I personally like to kind of highlight and discuss on this podcast, because I don't think that we're shining enough of a light on it. We do talk about, and it is absolutely pervasive and it is an epidemic in and of itself, clinical burnout, right? Our providers, absolutely. But there is also, I believe, a little bit of a hidden crisis out there that we don't talk as much about, and I like to shine a light on it, is the administrative burnout of our administrators, of our schedulers, of our team members that are, we go back to talking about team, right? What we talked about on the front end. Our team members that are there to help support and drive care, they may not be on the front lines meeting with our patients, but they're just as important as every other care, team member that is helping get that patient care. So when we start thinking about the administrative burnout as well, I mean, it is incredible what we've seen out there, and I don't think we talk about it enough. And so I got to think, Emily, what you and the team are doing to help support those folks that are in that kind of care orchestration, trying to get this taken care of, it's got to be just an absolute godsend to them as well.
Absolutely. I think that's a great call out. And I think it's something that as a former clinical leader, I struggled with, right? I would have vacancies for my schedulers, for my medical assistants, all of which can help with this type of work, right? Especially our schedulers. We know that there's a huge turnover in that role. I had one health system tell me that they have started to look at different ways because they can't staff their scheduling centers with enough schedulers to meet the demand. So I think some of the ways that I see DexCare really helping in that space is through our Omni search, we've had some of our healthcare system partners tell us that their emergency room physicians will pull up their website and search for what the patient needs to be able to then show when that patient can have availability for an appointment, who they need to see. So that is some of, the power of a great search engine that allows and bringing that access forward, which is one of DexCare's core beliefs is, being able to surface those available options upfront without 7 clicks. It is right there in 1 click. Really not only helps that patient, but it's helping the health systems themselves.
That is really cool, by the way. That is very powerful. Emily, let's now grab the proverbial crystal ball off the shelf, if you will. Let's look a little future state, not just for the industry, as you mentioned, you know as well as I do, I've been in this space for quite some time. We are still in the midst, and I think it's only going to continue to grow in the midst of this crisis in regards to workforce shortage. And that can be applied very broadly in every asset, every facet of healthcare. We are at crisis mode in regards to workforce shortage. So obviously we need to continue to think through how are we going to solve that. We discussed it here a bit. So what's looking like for future state to help with these crises or anything else that is top of mind from your perspective as, sitting in that kind of chair of expertise? What else should we be thinking about on the macro, what you're seeing in the next, few years? And of course, where is DexCare going to be a little bit in that future state as well, as you guys continue to hone in on that line of sight of where's DexCare going to be in the next couple of years? What's that crystal ball showing you at this time?
So I think it's important to think about the reason why DexCare was founded to begin with. And DexCare was founded because Providence and the Digital Innovation Group saw the need for patients to be met at Google where they were. They knew that they weren't coming to their healthcare assets. They knew that they needed to have easy ways for the patients to access the health system. I think we're going to continue to see that. However, we're not seeing the threat from retail like we did with Walmart and some of those, non-traditional healthcare players. Today, we're seeing this direct to consumer play, as I like to call it. The Hims, the Hers, the Rose, the Moochies, the whoever is on your social media feed that is accessing hormone replacement, erectile dysfunction, GLP-1s, weight loss strategies, they're targeting our health system's core patients, right? And they are the newest disruptors. And so I think that that's an important spot for us to think about. Those are often the well-insured, the patients that have quote unquote easy things to take care of for a health system. And it often leaves health systems with the challenging patients, the ones that need the most support. And so I think that it's important to make sure that we are helping to support our health system partners compete with the newest entries into the market, the newest disruptors. We've seen tremendous success, like we talked about, in the virtual urgent care space. But what's next for virtual urgent cares? We know that volumes have plateaued a bit from the pandemic. We know that there's seasonalities to virtual services. During cold and flu season, we see huge increase in volumes and demand. However, we don't see that sometimes throughout the rest of the year. Summer is one of those periods where volumes tend to decrease. So how can we help to leverage that same technology that's delivering cold and flu care to help deliver quick and easy access to the things that our healthcare consumers are wanting? Whether it's GLP-1s, whether it's hormone replacement, they want it from the convenience of their own home. And so I do think that that's a spot that, as I look towards the future, that I really foresee DexCare being able to help our health system partners fight against their newest competitors, helping to drive continuity of care, helping to keep and leverage those existing virtual care teams to provide new care, driving prescriptions to their pharmacies, helping to close in margins. That's what really excites me about kind of taking what was foundational DexCare and transforming it for the market 5 years, 6 years, 7 years later. That really excites me about the future. I think as we also begin to think about what we talked about, the workforce shortages, right? I was at a conference this last fall where a health system executive said to me, this is amazing because I need to figure out how to leverage the entire care team because I'm having to recruit not just one primary care provider, but two because of the desire for work-life balance. The newer physicians, the newer NPs are looking for ways that they can work maybe a 0.6 FTE, where historically maybe they would have worked a 0.9 or a 1.0. To them, it is about having a work-life balance. But that further increases our workforce challenges, right? And so what can we at DexCare help with? And so that's really where we are focusing in on capacity optimization. How can we both find and discover where there is capacity that's going unutilized in kind of my own historical journey, but also how can we help those health systems to leverage the entire care system? Can that orthopedic nurse practitioner be the online schedulable resource where they are that intake, they are that culture of yes type provider who is seeing that patient, getting them worked up, and then getting them onto the surgeon if they need to? Can we help them leverage a virtual visit where I can talk to you, Mike, as a nurse and take an intake, go through some protocol type questions and help to triage you to the best level of care? We know that AI is the buzzword, but we need to have some of that human connection when patients want to talk to a human being, not necessarily to a chatbot or to an asynchronous visit. I know as a mom and as a caregiver, there's just times where I want to just get on the phone with someone and talk with them or be on a virtual visit to have them hear my story, to be able to see what I'm struggling with and get advice to the best care options for me. And so we are infusing AI where we can in our product, where we think it makes the most sense. However, we really want to partner with our health systems to help them leverage their teams to provide the best care possible for their patients.
Well, thank you for that. And it's a very exciting tomorrow and where you guys are thinking about helping support our industry into the future. But of course, also need to then bring it back to yet again today, as we were discussing earlier, all the wonderful things happening today in the camp. But of course, we have a phenomenal community rallied around this podcast that loves to help our guests. So of course, we got to ask for today, what's one problem, need, or question that our community can be helping you with?
I think we would love to continue the dialogue. What are your biggest challenges? What is your biggest challenge to improving patient access? Is it the administrative burdens? Is it balancing and getting the right patients to you? Are you seeing patients that don't make sense? What are those pain points? And what technology solutions do you think would move that needle? I think that's one of the things that I love doing is talking to the health system leaders, the physicians, the clinicians that are on the other side of our product and understanding what their pain points are. But I think it's also for us is understanding the greater healthcare system pain points, not only from a patient perspective, but other healthcare providers, other industries. Where are your pain points and what would move the needle for you?
Well, in order to have those conversations, Emily, how do they get a hold of you? Social media handles, websites, contact points online. How do they track you down?
Yeah, I love the LinkedIn platform. So find me there, message me. Would love to keep this conversation going. Love to interact and certainly would welcome that dialogue.
Excellent. For our listening community, just simply scroll on down into the episode notes of the podcast player where you're accessing the show. Or you could head on over to our free global online community at passionatepioneers.com. There will be a post for Emily's episode where you can also leave some comments, feedback, suggestion, or otherwise. And of course, find those contact points online, again, over at passionatepioneers.com. Emily, a exciting, fun, informative conversation, something that obviously you and the team are taking very, very seriously and have a deep amount of passion for. So I knew this was going to be one heck of an episode. But of course, before we round it out and finish the episode off, we have one more piece for you. It's a fill in the blank. I'm a passionate pioneer because
I'm a fearless nurse who leverages her athletic experience, her goal setting to tackle some of healthcare's biggest challenges. And I have a great team at DexCare that's here to support me. And we look forward to partnering with you in the future.
I love it. Emily, thank you so much. I know how busy you are and the team is over at DexCare. So thank you for taking a pit stop to be with our community to share a bit more of what's happening in the DexCare camp. We look forward to continuing to follow your journey. But for now, of course, thank you so much for spending time with us today.
Absolutely. It was great to be here.
Thank you for joining us today on Passionate Pioneers with Mike Biselli. We'd love to hear your feedback about the podcast so we can continue to improve this community and to further support the pioneers being featured. Lastly, please take a moment to subscribe to the podcast and invite your friends and colleagues to join us. This is Passionate Pioneers with Mike Biselli. I look forward to having you back with us during our next episode.